Hi guys, we are from Group 5 of KAA class of Chronic Disease Management. My name is Caroline Laur and my colleagues are
Jasprit Kaur, Simranjit Kaur, Nimi Tom, and Tanuja Thakur. We are here to present to you one of the best practice guidelines included in the Registered Nurses of Ontario, which is the management of hypertension. The purpose of this discussion is to increase awareness, knowledge, and understanding related to the reduction of risk and management of hypertension. And our learning objective is to improve recognition of the importance of early detection of hypertension, being aware of the signs and symptoms, risk factors, and prevention for further complications of hypertension. Our group has formulated a three-folded pamphlet in order to spread this information to target population such as adults and people who are at risk in developing hypertension.
According to Centers for Disease Control and Prevention, hypertension, or also known as high blood pressure, occurs when the blood pressure is higher than normal. In order to be considered as hypertension, the blood pressure must be checked 2 more times or separate days. If it is consistently above normal, the systolic blood pressure reading on both days is more than 140 mmHg, or diastolic blood pressure reading on both days more than 90 mmHg. Also called as silent killer because it shows no obvious symptoms, and more often the signs and symptoms are misinterpreted. Common symptoms of hypertension includes early morning headache, nosebleed, irregular heart rhythms, vision changes, and buzzing in the ears. Severe hypertension can cause fatigue, nausea, vomiting, confusion, anxiety, chest pain, and muscle tremor. As stated in the best practice guidelines of RNO, it is highly recommended to have an early detection of high blood pressure. Therefore, assessment of blood pressure for adults regularly is important. Diagnosis of high blood pressure is confirmed by healthcare professional. According to Statistics Canada, the prevalence rate is hypertension is higher, which affect 1 in 4 Canadian adults.
Hi everyone, my name is Tanuja Thakur. Here I am going to continue with the importance of blood pressure monitoring. First of all, blood pressure is the force of blood pushing against the walls of the arteries. In order to understand the blood pressure reading or blood pressure monitoring, basically it is measured by two numbers. First one is considered as systolic pressure, which is known as top number. It occurs when heart contracts. And the second one is diastolic pressure, which is considered as bottom number. It occurs when heart relaxes in between the beats. The main purpose of taking blood pressure is to check the pressure of the blood in the arteries, whether it's increased or decreased, to find out that how hard heart has to work. If the higher is the pressure, the greater will be the damage to the arteries or walls or blood vessels. And sometimes this condition can lead to life-threatening situations such as heart attack, stroke, or kidney failure. Thank you.
Hypertension is very common nowadays. It is associated with the modifiable and non-modifiable risk factors. As per World Health Organization, the modifiable risk factors are diet, lack of exercise, overweight, smoking, alcoholism. These are the most common modifiable risk factors which we can see nowadays. Most of the people, they are living sedentary lifestyle. There are some not modifiable factors we can find also, especially age over 65, family history, and some comorbidities like diabetes. So these things we cannot change.
Good morning all of you. I'm Jasprit Kaur. I'm going to explain about the different categories of blood pressure. American Health Association has described blood pressure under 5 categories, that is normal, elevated, hypertension stage 1, hypertension stage 2 and hypertensive crisis. In normal, the systolic blood pressure is less than 120 mm of mercury and diastolic blood pressure is less than 80 mm of mercury. In the elevated, The systolic blood pressure is 120 to 129 mm of mercury, while the diastolic blood pressure is less than 80 mm of mercury. In hypertension stage 1, the systolic blood pressure is 130 to 139 mm of mercury, while the diastolic blood pressure is 80 to 89 mm of mercury. In hypertension stage 2, the systolic blood pressure is greater than 140 mm of mercury, while the diastolic blood pressure is greater than 90 mm of mercury. And the last stage is hypertensive crisis. In this, the doctor should be consulted immediately. The patient is at very high risk. In this, the systolic blood pressure is greater than 180 mm of mercury, while the diastolic blood pressure is greater than 120 mm of mercury. Thank you.
According to RNAO's best practice guidelines, these are the nursing management of hypertension. Educate the clients and their families regarding the importance of self or home blood pressure monitoring and know when to consult immediately. Educate clients on their target blood pressure and the importance of achieving and maintaining a normal target range. Help the clients recognize the lifestyle factors that may contribute to the management of hypertension, such as
Diet. Too much intake of saturated fats, salt, and sugars are actually risk factors for developing hypertension. Therefore, dietary approaches to stop hypertension or the DASH diet is very important to consider in reducing blood pressure. The DASH diet includes vegetables, fruits, foods low in cholesterol, saturated fats, and dairy. And according to Heart and Stroke Canada, the DASH sodium diet is also important and it has a greater impact in lowering blood pressure. So the lesser the consumption, the greater the reduction of blood pressure. The recommended dietary intake of sodium is 65 to 100 mmol per day or under a teaspoon of salt per day.
Healthy body weight is important symbol of good body function. There are some researchers already proved that the body weight and blood pressure are on positive correlationship. So it is recommended that body mass index should be between 18.5 and 24.9. Exercise is one of the important strategies that help us to maintain normal body function, especially normal blood pressure. Every day we can do different kinds of exercise, very simple exercise like walking, jogging, climbing stairs, doing some household activities, bicycling. So we should make sure that when we do such kind of exercise, if we feel some fatigue or if we feel some shortness of breath, it is mandatory to
Alcohol. Limiting alcohol intake can help reduce or prevent blood pressure. 2 standard drinks per day or 14 drinks per week for men, 1 standard drink per day or 9 drinks per week for women, and lighter weight men. Limiting alcohol intake is about moderation, but it is not possible. Ask help from healthcare providers.
So, cigarette contains nicotine, which causes hardening of the blood vessels or the arteries, which increases the blood pressure. So, promotion of smoking cessation is very significant. It plays a vital role in order to control the hypertension.
During a stressful event, the body releases adrenaline and cortisol, which are the stress hormones, and which causes the body to do flight and fight response, in which the heart rate increases, and it also constricts the blood vessels, which results in the increase in the blood pressure. So it is very important to manage the stress to deal with the high blood pressure. So for that, relaxation techniques like deep breathing and imagery plays an important role. The nurturing and supportive environment also has the role to play in managing the stress.
to help fight against hypertension. As nurses, we have to facilitate changes in clients' behavior. We have to promote adherence by encouraging and reminding the clients a routine of taking medications as prescribed, attending follow-ups in a timely manner, The client's ability to follow the hypertensive treatment plan is also a key factor in managing hypertension. Self-efficacy, according to Araneo, is an individual's belief that he or she is capable of dealing with a specific problem. If the client has a low self-efficacy, then the client may resist in changing his or her behavior. Self-care. Maintaining self-care is very important to facilitate adherence.